Good morning. This is Kim Kennard, Director of Employee Benefits here at Cornerstone. Next up, we have UnitedHealthcare, a top carrier throughout the U.S. and Ohio. They're here to talk about their 3 small group medical options here in our state. All savers, level funding, good for groups 5 to 99, ACA plans. UHC's consistently had the best rates throughout the state. And their newest offering that was launched last fall, the Ohio Chamber MIWA. I've seen this product heat up lately, so you're going to want to learn all you can about this one. Lastly, they're going to talk about ancillary options through United for life, dental, vision, and disability. I'm going to pass the baton over to AJ Miller, the VP of Small Business here in Ohio, to introduce his fantastic team. Welcome, guys.
Thank you, Kim. Appreciate the kind words. I agree. The team is fantastic, and we're definitely excited to be here and share kind of the updates that we have throughout the state. Again, I want to thank everyone for joining. I don't want to steal too much of Ed and team's thunder. They've got a lot of great updates for you guys, but I just wanted to let you know that based on a number of feedback items we received from the broker marketplace, we've instituted a number of changes to some of our plans to better align with client needs. We'll be talking about those in a little later in the presentation by adding a couple of new plans and moving to a new PDL card. We've also had very strong sales results across the board through our 3 product offerings. Kim mentioned the ACA rates have been competitive. They still are competitive statewide, and we are seeing quite a bit of activity in that segment. Additionally, we've had quite a bit of success with our All Savers product, and more so on our chamber product that we have with the Ohio Chamber of Commerce, the MIWA. Sales are ahead of expectations, and our persistency has improved across all lines of business as well. So sales have been strong, persistency has been strong, so we're very pleased with the results. Kind of going along the same lines of persistency, as everyone knows, our MIWA product has a common renewal date of 1/1. We just recently got our renewal rates for the Ohio Chamber MIWA block, and over 90% of the groups that we have will see below target, below trend renewals, which is great. Even more so than that, 70% of the groups on the block will be seeing a low single-digit renewal. So the block is running exceptionally well. The renewals will reflect how well it's been running. So we're excited to be releasing those actually in the very near future. So I just want to give those couple of points of interest on the Ohio Chamber. Lastly, I wanted to talk about a couple of things that we're doing statewide from a marketing perspective in order to give back to the community and provide more opportunities for small businesses to benefit from different campaigns that we have. One of the benefits that we have operating with the Ohio Chamber of Commerce is that we can see statistics on surveys that they send out and what's important to small businesses. And it allows us to align some of our offerings and create products that will help in some of those areas. Consistently the top 5 things that small businesses are interested in or are concerned about is the cost of healthcare. That usually ranks as number 1 or 2. That's specifically why we partnered with the Chamber to develop a program to offer lower healthcare coverage. But additionally, client acquisition. When I say client acquisition, I'm talking about small businesses don't necessarily have a large budget often for marketing campaigns or getting their name out to customers in the marketplace. And so we wanted to create the ability for small businesses to have a chance to get free marketing statewide in Ohio. Last year, we had a Spotlight on Small Business program where we we would take clients or customers. They didn't have to be a UnitedHealthcare customer. They could just be a small business. And we would take them onto the field during the third quarter of a Buckeye game and put their name on the big screen and give them free advertising from that perspective. It was a huge success. The small businesses that won were very thankful, and we've had to change that a little bit because obviously the season has been modified, but we still wanted to provide some type of campaign that allowed small businesses to access free advertising in the future. So we still developed the small business spotlight on small business, where we'll be choosing 4 winners, and those winners will be receiving a marketing package. Often it'll be digital marketing. The Buckeyes have a talk show where these groups will be brought up, and we also have podcasts that will be allowing small businesses to take part in and get their name out into the marketplace. We also have social media. The Buckeyes have social media campaigns where they'll be advertising through their digital resources, the small businesses that win, and there'll be digital ads. So that will be coming out in the very near future. Brokers actually can apply for this as well. And so if you wanted to, since many brokerages are also small businesses, they could potentially take advantage of this program as well. So the website, in order to register for this program, is uhcbusiness.com/Buckeyes. Again, that's uhcbusiness.com/Buckeyes. So again, in the near future, that site will go live. You'll be able to register. I also would recommend letting your small businesses know that they can register. So we definitely want people to take advantage of this and get the free marketing that they deserve. So that's really all I had to kind of open up the meeting. Again, I appreciate everyone's time. We are looking forward to working with you for the remainder of this year, and excited to announce a number of new options that we have. So with that, Ed, I will pass it back over to you.
Great. Thanks, AJ. Here's today's agenda for small business, and we're going to be talking about quoting. We're going to be talking about our essential PDL transition, our chamber product, our All Savers product, our ACA product, in addition to value adds that we have with all of our product portfolios. The first screen here is just about quoting. So we are up and running and quoting for both of our small group underwritten products, which would be our MIWA product through the Ohio Chamber, and All Savers, which is our level funded program. So we do recommend groups that are in the 1 to 50 market that you do quote both of our underwritten products. We do see almost an equal amount of sales from both product offerings, the MIWA and All Savers. Some of them meet some groups' needs, and other times the other product meets a whole different amount of needs. So we do recommend that you send both sets of applications and have them quoted at the same time. That helps us as far as turnaround time when we quote and underwrite both at the same time. For those that use FormFire, I just indicate on here what forms that we need. For the MIWA, you just need to look at the carrier UnitedHealthcare in the form OH MIWA. And for those that are looking for the All Savers quote, the carrier would be All Savers, not UnitedHealthcare. And there are a number of different forms out there, and the correct form is the All Savers Alternate Funding EE Enroll application. Just to let you know, too, we are quoting 1/1 effective dates for both of these products as of about 2 or 3 weeks ago. We are allowing applications to be a little bit longer dated than we traditionally do. Right now, up until 1/1 effective dates, we will allow our applications to be up to 120 days old from the effective date. That will go back to 90 days, most likely, starting with February 1st effective dates. Now, one thing I really wanted to mention also is during the busy season, when we see our RFP numbers just drastically increase, it obviously could create some bottlenecks sometimes, and our turnaround times tend to slow down a little bit. But one thing that is extremely important is if you can provide all the information that we need to quote up front without us having to ask for missing information, it's going to drastically increase both your turnaround time and the turnaround time for our whole agent community. So kind of just wanted to point out a few things that are very commonly missed that we have to push back for. Biggest one is the AT&E count, average total number of employees. We need that because that's what we determine what size segment the group's in and what products we can quote. So if you do not indicate that, we will always push back and ask for that. The main thing is we just need to know, is it 50 or less or 51 or more, so we quote the appropriate products. Broker name and agency name is something that we need and we'll push back for if not received. Effective date we need just to make sure we're quoting what you need. One thing that we require is a prime enrollment spreadsheet that's in FormFire to quote groups. Now, usually this is a census. Yes.
Hey, Ed, this is Kim. I'll just jump in here. If the brokers are using Cornerstone's 2019 to 2020 template, it collects all of this information. And if they use FormFire through Cornerstone, we have the ability to download the correct census. So our brokers don't have to worry as much about this stuff. So anyways,
well, I guess
just want to throw that.
I'm glad that you mentioned that. So that obviously this won't be as that important since Cornerstone has the ability to collect all this information for you. One thing to point out too with All Savers is All Savers standardly quotes commission of $20 per employee per month, but it's really up to you what you want to quote. So if you would like more, let us know during the quoting process up front. I would probably venture to say our average commission that we quote is anywhere between 25 and 30 for brokers. The MIWA, you don't have an option, but we automatically pay $30 per employee per month. Another thing is just carrier name. If you could provide us that, Cornerstone may already have that for those using them, but we need that because we want to make sure if it's currently a UnitedHealthcare group that we don't quote it as new business and we send it to the renewal rep for you. Again, that's all we need for quoting, and that's what I wanted to point it out. I'm going to move over to our Essential PDL and have Ray Gazinski in our Columbus office talk about our Essential PDL. Ray?
Thanks, Ed, and good morning, everyone. For those that don't know me, my name is Ray Gazinski. I am the Small Business Account Executive in the Columbus, Ohio market. So today I have some really exciting and significant pharmacy enhancements to go over with you. You know, with the rising cost of healthcare and the ever-growing percentage that pharmacy makes up in the total cost of that healthcare, everyone's really looking for greater cost controls, transparency, and ease of administration. And today I'm going to be going over the Essential PDL, which significantly moves the ball towards that direction. So what is the Essential PDL? The Essential PDL is a closed PDL that's narrower than the Advantage PDL, the PDL which we've been using for a number of years. The Essential PDL allows for a substantially greater cost containment to the group while offering a significant amount of savings on the overall premium. This is accomplished through both tiering and through exclusions. Some of you may be familiar with this PDL for your larger group clients, which we've had for some time in the Ohio market, but the Essential PDL is quickly becoming the lead PDL for small group nationwide and in Ohio for UHC. We're very excited to be rolling out the Essential PDL to the Ohio Chamber, MIWA, and the ACA beginning on 1/1/21. And this is also quotable in All Savers beginning back on 9/1 as an option. So you'll have the option to quote either the Essential PDL or the more expensive Advantage PDL whenever you're running an All Savers quote. So what's the financial impact to the employer and employees? The Essential PDL will drive a 2 to 4% premium savings and an average of 16.5% in potential pharmacy claims per group. Employers, especially small business owners, and especially in today's uncertain economy, are incredibly price sensitive. So with pharmacy accounting for just over 20% of the total medical spend, and that number is very rapidly rising, the Essential PDL and the significant savings that come with it, with the limited disruption, make it a game changer for a small business. Next slide. Unlike the Advantage PDL, which includes all of the FDA approved drugs, has 400 exclusions that are filed and contained in the COC, and has a very limited coverage review and appeals process, the essential PDL is a closed formulary, meaning that only drugs listed on the PDL are covered. While this necessarily means that the essential PDL is a leaner formulary, it does include a much wider and more streamlined access to coverage review and appeals. Next slide. So how does the essential PDL compare to the Advantage PDL? The essential PDL has 200 additional exclusions and 200 up tiers. The level of disruption to most groups is not significant. The essential PDL has been around for quite a while in Ohio and around the country, and we've routinely found that the level of disruption to any group is anywhere between 3 and 6%, which is really not all that much more than switching from one carrier to another. This is a leaner PDL, but it's still a very robust PDL that includes coverage for all therapeutic categories, so members will always have access to pharmaceutical treatment for clinical management, and also comes with a more robust and streamlined review process. This review process is a very real solution for the majority of individuals who may have a specific need for a non-formulary alternative, and is going to be available for every drug that is covered. Next slide. And UHC has a number of tools to mitigate any disruption that may occur, that are both available to you and to your clients. The first is www.welcometouhc. This is our pre-member website that allows you to both look up providers and medications quickly to determine how they're covered under the PDL. This is a very useful tool anytime you're looking at any UHC business to be able to look up doctors and drugs. We also have our transition of care policy, which acts as a one-time 30-day override for new customers to fill a prescription. This allows members to work with their providers to find a covered alternative or time to seek a medical review, and this is instantaneous. The member just calls a number on the back of their ID card while they're at the pharmacy, and the override is automatically applied, giving them the extra time that they may need. Note that both Welcome to UHC and the Transitional Care Policy are available on all UHC products. I'd also note that the Essential PDL, like all of our PDLs, have a number of embedded programs that have a significant added value. These are things like point of sale discounts, our opioid management programs, OptumRx home delivery, OptumRx specialty services, and Pre-Check My Script, which is a provider tool that really mitigates the disruption to both you and your clients. And I believe that that is all that I have on the Essential PDL, and I will be turning it back over to Ed.
Okay, thanks, Ray. I'm going to be going over our 3 different products that we're offering for small groups, both our MIWA, All Savers, and our ACA, specific to January 1st coming up. So most of you probably already know our MIWA has a common renewal date of January 1st. So all groups sold with the MIWA are going to renew on January 1st, regardless of what their effective date was when they sold with us. For groups that we are currently quoting or just sold between the months of 9/1 through 12/1, they will renew obviously early on January 1st in a few months, but all they will receive is a minimum trend increase for 1/1/21. They will also be moving to the Essential PDL. So for an example, for those of you that might have sold a September 1st effective date with our MIWA product, when they renew early on 1/1, which is in 4 months, they're going to get 3 months worth of trend, or 4 months worth of trend, which is 3%. In addition to that, they will be moving to the Essential PDL, so there's a discount that is associated to that that's approximately 2 to 3% lower. So for those groups that moved with us 9/1, when they renew January 1st of 2021, they'll almost receive a pass on their rates because they're moving to the Essential PDL. Now, just to let you know, right now, as of a week or 2 ago, when you request a new business quote and we provide you, let's just say, an 11/1 MIWA quote, you will receive 2 quotes for our MIWA product. It will be both the 11/1 effective date that you requested, in addition to what the 1/1/21 renewal rates will be, so you know what those costs are going to be up front, so you can share with your clients. If you did sell a 9-1 or a 10-1 group already and did not have the quote, since we just start quoting those recently, just reach out to Cornerstone and then we could provide you what those 1-1 rates would be. Now, as far as groups that we sold in the past, so any groups that we sold basically with an August 1st effective date of this year and prior, so all this year and the handful that we sold the beginning of or the end of 2019, those groups will go through the normal renewal process. And they will actually have the option to either renew to their Advantage PDL that they're currently on, or move to the Essential PDL at the renewal and take that 2 to 3% savings. So for those groups that we've had a little longer, we are going to give the option to maintain that Advantage PDL if they would like. For groups that are sold September 1st, 9-1 through 12-1, the only option we have is for them to move to the Essential PDL. But again, you do get the price savings that we have for that. And then obviously, any group that we're quoting in 2021, 1-1 or further on, once we start getting 2-1s and 3-1s, everything will be quoted on the Essential PDL with the MIWA. Now, as you probably, if you work with UnitedHealthcare, we do change plan designs, usually yearly. And one thing that we've really been trying to do over the last number of years is really reduce what our portfolio is. At a few years ago, maybe 5 years ago, it was huge. There was too many plans, and we do have a fair amount of plans, but we are always being mindful of that. So we have reduced the number of plans that we usually do with our ACA portfolio. For our MIWA portfolio, we have heard from a number of agents in all markets that we do need PPO plans that have 100% coinsurance. It's something we've been asked about for months and months. So we reacted to that. So starting with our 1-1 MIWA portfolio, we have added 3 new PPO plans that have 100% coinsurance. But in the theme of making our portfolio small with the chamber, we decided to remove plans. So we removed our 2 primary Advantage plans, which most of you may not even know what they were because we didn't sell too many. And we had 1 PPO plan that had very little membership. So we removed 3 plans that had less than 100 members enrolled throughout the whole state of Ohio to add in those PPO plans to maintain a total portfolio of 15 plans with our MIWA. For those that don't know, we can sell as many plans in the MIWA as you would like. So there's total of 15 plans. It's up to you and the client, but we can sell any number of the 15 plans that you would like to a client, whether it's 1, 2, 3, 4, 5, whatever. I think the most I've ever seen sold is 3, but just to let you know, we can sell any combination of plans that you would like. As I mentioned before, we're moving to the Essential PDL. That is a 4-tier PDL. And a couple little things that I'm not going to focus on because Donna in our office will be going over the value adds at the end of the presentation, but motion is available on all the HSA plans that we offer in our MIWA portfolio. Real Appeal, our 52 weight loss program, is available for every plan. Free virtual visits on all non-HSA plans. And this portfolio is quote ready right now. So if you need a 1-1, we'll be able to quote this MIWA for you right now. Now, here's a little guide I'm not going to focus too much time on, but if you need it, we can send it out to you. It's basically letting you know what our 21 plans are compared to the 2020 plans. With UnitedHealthcare, we always do have to come up with new plan codes anytime we make a change. Since we're moving to the Essential PDL, we did need to change the medical plan names, but the medical benefits are the exact same as they were in 2020. It's just the plan code is different. So we can provide you this grid here at your request through Cornerstone to let you have an easy guide to show what plans are matching up to the 2021 plans. And then lastly, with the chamber is obviously it's through the Ohio Chamber of Commerce, and they're going to require that both the employer and your agency be a member of the chamber to be able to sell this product. The cost for the employer is listed to the right. And one thing I really wanted to point out is it's based on how many enrolled employees with the chamber medical plan. So for the instance, the first line for groups that have 2 to 10 employees, that would be enrolling employees in our medical coverage. So a group could, let's just say realistically have 20 employees and only 10 enroll. they will get the benefit of only paying the $250 because it is based on how many enrolled in a medical benefit. Right now, through the end of August of 21, the Chamber is offering a $100 discount for groups for their first year. And that discount is also being offered for brokers that may have not joined yet either. So as you can see on the left side, the Chamber does have 2 membership levels for brokers and agencies. $500 is a standard membership, and $1,000 the preferred membership, which you get your agency logo on the Chamber side with a link to your website. Again, we are doing that $100 discount for brokers up until 8/31 of 21 as well. So that's it, what I had for information on our Chamber. Next, I'm going to be talking about our other underwritten product, All Savers. It is a level funded, alternate funded product that we've had in the market since 2014. When we came out with All Savers in 2014, I think we were only in 4 or 5 states, Ohio being one of the first ones. But as you can see through this state, we have drastically expanded that and are in 44 of the 50 states in the country right now. We do sell a number of business with our Ohio brokers in non-Ohio states, so always keep that in consideration. If you have a small group that you want to quote that's non-Ohio, there's a good chance that we'll be able to provide you an All Savers quote. One thing I like to always point out with All Savers is that it's a 1260 stop loss period or contract. So basically what that means is for claims that occur within the first 12 months that you're with All Savers will pay those claims for up to 60 months. Extremely long period. We did that for extra protection and let our small groups know that we're serious with this product, and we didn't want to have a client be responsible for any claims after they leave UnitedHealthcare All Savers. We obviously don't get a lot of claims, probably in the 50th month, but as you can see on the bottom here, as of March of this year, we've paid out a total of almost 2,300 claims that were processed after 30 months for total payments of almost $750,000. So as much as it doesn't happen very often, it does happen. And we just want to give that extra security to people that are taking this program to know that they're not going to be on the line for claims once they leave UnitedHealthcare or that occur in the first 12 months. That's why if you hear me talk about All Savers before, one thing I always like to say is that it really acts and smells and feels like a fully insured product because of the 1260 contract. Also with All Savers is groups get an opportunity to get a refund if they perform well. Right now in Ohio, if the group's sold situs out of Ohio, we give a 50-50 refund. So we give 50% to the employer if there's a surplus, and we keep 50% as a deferred fee to pay those additional future claims. Every state is different as far as if they do give a surplus or not, and what percentage it is. And we just want to let the brokers in Southwest Ohio know that we know you sell some Kentucky business, and in Kentucky, the refund is actually 2/3 go back to the group, and 1/3 is kept by UnitedHealthcare. But I wanted to show some statistics on this. So if you look down there, I give both Ohio and national averages for refunds. And in Ohio, basically 40% of all groups are getting a refund that are with All Savers, and that average refund is $6,500. So as much as we talk about a refund, and most groups think that, or brokers think that, hey, the chances of a group getting one is probably small, it's actually pretty good because 40% of our groups are getting refunds right now. Now, as far as some things about All Savers that we really want to point out is we have done this in the past, and we're doing it this year as well. So for any All Savers group that you sell with an effective date of 12/1 or 1/1, those rates can be sold for either 15 months or 12 months. It's up to you. You don't need to ask for 2 quotes. So we will provide you one All Savers quote, and if that effective date on there is 12/1 or 1/1, those rates will be good for either 15 months or 12 months. It's up to you. If you do go 12 or 15, when we do install the group, we just have one piece of extra paperwork where you sign off on whether you want 15 or 12 months. But again, you don't need multiple quotes. You just need one quote, and it's up to you what you want to do. Now, Ray talked about the essential PDL, and we are quoting the essential PDL with All Savers right now as of 9/1 effective dates. The difference with All Savers is, since it's a national product, is we are still standardly quoting our Advantage PDL. So if you request a quote with All Savers, those are going to be Advantage PDL prescription drug programs that are attached to those plans. You can request the essential PDL, and basically if you do, the medical plans are going to be the same, but you will get anywhere from a 2 to 4% savings off the total medical premium by quoting the essential PDL. So we do recommend that you ask for that, but ultimately it's really up to you whether you want the Advantage or the essential. Our other products, the MIWA and our ACA, are moving to the essential PDL for 1/1, and there's not going to be the Advantage PDL option like All Savers. But All Savers runs on a different schedule as far as when we update the portfolio. We update it every September, so we could see that possibly change in September of 21. But as of right now, we're allowing you to do both. There is also one difference with the pharmacy network with the essential PDL with All Savers. There is something that's called a standard select network, which is a smaller, narrow network of pharmacies. And I don't like using the word narrow because with our standard select network, there's 50,000 pharmacies across the country that are participating in it, including Walgreens. And normally our Advantage PDL has 65,000 pharmacies. So it's really not paring it down that much. We did an analysis of all our data and our prescription users that are throughout the state of Ohio, and the pharmacies that are in the standard select network are more than adequate, including Walgreens. And if you need that information, just reach out to your Cornerstone rep, and we actually have a brochure on what those network pharmacies are. One thing I also want to mention with All Savers is for every plan that we have what we call our EPO version of that plan, where it's a plan that only has in-network only benefits. This saves approximately 3% on the overall premium. We recommend brokers look at these plans because in Ohio, our network is so large that it's worth the savings. For instance, every single hospital in the state of Ohio is contracted with our Choice Plus network. So most of the groups that are moving to these EPO plans really do not see much of a difference since there is so few out-of-network claims with All Savers since our network is so large. Again, with All Savers, you can sell as many plans as you want. As long as the quote that you have has the plans that you want to sell, then we can sell as many plans to the group as you would like. Not going to really talk much about Real Appeal and Motion and virtual visits because Donna's going to be talking about that soon. But one thing to really point out that's a little different with All Savers is Motion is included on all plans at no cost. So that means not only the HSA plans, but all the other non-HSA plans have Motion tied to All Savers. A couple benefit enhancements that we made on August 1st of this year, and this would be for not only new groups, but existing groups. Groups that are not COBRA eligible, so they're usually a state continuation type of group. State continuation does not apply with All Savers, but we have added a survivorship benefit where dependents of employees that have passed away will be allowed to extend their coverage for an additional 12 months. And then another great addition that we did is we are actually allowing people to get a 90-day supply of medications through a retail pharmacy. You will not get the benefit of the mail order 2.5 copays. You will have to pay 3, but you will be able to get a 90-day supply of your medications at a retail pharmacy. And then lastly, this slide here is really just talking about the Advantage PDL and Essential PDL, how we can quote both. I've really gone over this information, so I'm not going to talk any more about it. But again, just wanted to show this out here. That's it for our All Savers, and now I'm going to be talking about our ACA portfolio for 2021. This has a lot of data and a lot of words on here, but with UnitedHealthcare and our ACA product, we basically have what we call multi-choice packages. And basically what that is a set of plans that are in one package that when you sell a group, you can offer as many plans in that package as you would like. We've actually reduced the number of plans that we had for 2021 again. So I would say probably 2 years ago, we had a total of 60 plans, and we've weeded that down to 33 plans. There are the plans that we traditionally sell to groups. There is going to be 3 packages, though, that we can quote, and it's going to be based on the zip code of the group. So we have a statewide package that's available for every group in Ohio that has a total of 33 plans, and that's package 43. Now, there is a Cleveland package that is package 44, and the reason for that is because we have what we call Nexus ACO plans that are driven by University Hospital. These plans are only available if the group is situs in one of the 8 counties listed below, from Ashtabula to Portage. So when Cornerstone runs a quote for you and it has a zip code that's in, let's just say, one of these 8 counties, they will be quoting package 44 for you. And basically what that means is it's going to be the 33 plans that are in package 43, in addition to these 4 Nexus ACO plans that use University Hospital. I will be going over our Nexus ACO plans after this slide. And then the same thing is true for Columbus. Columbus has its own package with the 33 plans plus their 4 Nexus ACO plans. Columbus is a little different, where they use a set of physicians as their ACO and not a hospital system university like we do in Cleveland. They're only available in 4 counties in the Columbus area. And again, it is physician-based only. So all hospitals that are in the state of Ohio will be considered to be a Tier 1 Nexus ACO provider, since the Columbus package is physician-based. Now, one thing to point out with multi-choice, and I said, as long as you sell one package, you could sell as many plans within the package. If you have a group and you want to sell, let's just say, 3 plans to an employer, and you do enrollment meetings, and only 2 of the 3 plans actually have membership enrolling in it at the time that we sell it, we can still install that 3rd plan if you would like, even though it has no membership for future use. So again, with multi-choice, we could sell as many groups as plans as you would like to your groups, even if there's no membership in specific plans. And to go on the theme of us reducing our portfolio, I mentioned how we only have 33 plans now. We removed our primary advantage plans, which were 11 plans from our ACA portfolio, like we got rid of our primary advantage plans in our MIWA portfolio. We did add 4 new plans that are called assured plans, and I'll be going over those too as well, because those are going to be more affordable, lower cost plans. And as I mentioned before, Central PDL is moving 21 for our ACA, and Motion is available on all HSA plans. Now, here's a few slides about our Nexus ACO. Obviously, with these are our top performing providers in the area. And these physicians and hospital systems do great work for us. And we do a lot more reporting and sharing of data to make sure that our members that are enrolled with these hospital systems and physician systems are getting the best quality care. This really drives quality and cost effectiveness with our Tier 1 providers, which are the providers that obviously provide the higher quality and low cost. With our Nexus ACO plans, they are the only plans that we have where you do have to pick a PCP up front in enrollment and get referrals to see specialists. If you do not, then you will not have any type of benefit. Now, why are we doing this? And the reason is we know that our members that are going through our ACO partners, which would be Central Ohio Primary Care in Columbus and University Health System in Northern Ohio, we get better outcomes. So here's just a few statistics that I like to share. We have 12.2% more members having PCP visits than on non-ACO providers with fewer specialist visits. ACOs had an average of 13.4% higher cancer screening compliance. ACOs have a 12.7% higher annual diabetic screening compliance. ACOs have 5.6% higher persistence for follow-up treatments. And then obviously well child care is at a much higher rate. So we wanted to create plan designs with our ACO partners because we know that members that are using them are maintaining a healthier lifestyle, getting better quality care, and receiving care that they need through PCPs and cancer screenings and diabetic care throughout the year at a higher percentage than our non-ACO population. Now, I want to show you an example of a specific ACO plan that we have in our ACA portfolio. This is the plan CCWB that's on our new product grid that we just finalized last week. The plan has a deductible of $1,250 and an out-of-pocket max of $5,000. But one thing that we really want to point out is our Tier 1 benefits versus our network benefits. Tier 1 benefits for the ACO would mean that there are ACO providers, so that would be University Health System and Central Ohio Primary Care. If you use one of those, the selected PCP copayment will be $50. If you do pick a primary care physician that is not one of our ACO providers, you can do that, but your benefit is drastically reduced to deductible plus 40% coinsurance for that benefit. If you go to see a specialist, that's in our ACO network, it's a $50 copay with a referral. If you don't and you just use our normal network providers, it's going to be deductible plus 40% with that referral. And then all the other relevant benefits like inpatient, outpatient, surgical fees, and information like that, you will have a richer benefit if you use our ACO providers with a referral, because it will be deductible plus 20% coinsurance, versus if you get a referral and do not use the ACO providers, it will be deductible plus 40% coinsurance. Again, one thing to really point out too is if you do not get a referral, you do not have coverage, and these plans do not have out-of-network coverage. These plans we see probably being a viable option for groups this year, because we see that affordability, especially during the COVID situation, is becoming more and more important. And these plans drive usually anywhere from a 15 to 20% reduction in overall rates. So please take a look at these plans. But again, they're only available in 8 counties in the Ohio area and 4 in the Columbus area. Lastly, I want to go over one of our new Assured plans. I mentioned that we did come out with 4 new plans that are called Assured, and these are some of our lowest cost plans that we have available. Here's an example of a plan that's called the CCV8 V6 plan. These are offered throughout the whole state of Ohio. These plans specifically have very high deductibles between $4,000 and $8,000, or $4,000 and $7,000, and higher out-of-pocket maxes, and 70% coinsurance. So on this specific plan, it's a $4,000 deductible, 70% coinsurance to $6,500 out-of-pocket max. If you go to see one of our Tier 1 providers, now what we mean by Tier 1 is not the ACO providers, because that's specific to those ACO plans. UnitedHealthcare has the premium designation program where we tier our physicians nationwide. And if somebody uses a PCP that's a Tier 1 provider, it's a $60 copayment. If they use a provider that's not Tier 1, they're going to pay deductible for that office visit and then a $30 copayment. Same is true for specialists, $60 copay for Tier 1 specialist, and deductible plus $60 for our network providers, which are the non-Tier 1. Coinsurance is 70% on these plans. And in addition to that, the essential PDL that we'll be quoting will have a deductible of $300 just for the RX, and that is waived for Tier 2 and Tier 1 medication. So it only apply to Tier 3 and 4. Obviously, these plans are generating a very, very low cost because of the high deductibles, because of steering people to our Tier 1 highest performing providers. So these plans may not be for everybody, but given the environment, we needed to come out with plans that address the affordability issue. And we think this will be a good option for those groups that need to really take a strong look at the plan designs that they offer. That's it that I had so far with all the information about our new portfolios for 1/1. Next, I will be transferring over to Donna Hasselbeck to talk about our value adds. Donna?
Thanks, Ed. Thank you, Ed. My name is Donna Hasselbeck, and I'm the sales rep for Southwest Ohio, Dayton, and Northern Kentucky for UnitedHealthcare. And it's good to be here with everybody to talk about our value adds that are included with our products. So the first one that we're going to talk about is going to be Healthiest You. So Ed, flip next slide. Healthiest You is a value add that is included on our All Savers product portfolio. And Healthiest You is an app and it allows employees to talk to a doctor from anywhere at any time, 24/7. The neat thing about it is there's no copay or cost to an employee when they use HealthiestYou. This means they can manage many of their situations that would normally involve an office visit to a doctor without even leaving their home. Statistically, over 70% of ER and urgent care visits can be safely and effectively handled over the phone. That's why we like to encourage our All Savers members to use HealthiestYou. After somebody is enrolled with the All Savers program, we encourage people to register for HealthiestYou. And one of the neat features that was recently added was All Savers HealthiestYou will allow non-covered dependents to enroll for the HealthiestYou benefit. Now, when I do an open enrollment meeting, one thing I like to encourage is to have employees go online and register those non-covered dependents as soon as they get their ID card, because it's easy. If somebody does become sick, a non-covered dependent, it's easier to have access to this program if the non-covered dependents are already enrolled into the system. Another feature of HealthiestYou is called Expert Medical Services. This is formerly known as Best Doctors, and this service provides employees with guidance when they're facing a complex medical situation. It actually enables members with those complex situations to receive independent expert evaluations on that particular diagnosis that they just received at no additional cost. HealthiestYou is also adding some additional services effective 8/1 for behavioral health. So if somebody wants to have some kind of counseling maybe over the phone, they can contact a behavioral health counselor all hours of the night and receive services for behavioral health. We've included back and neck services along with dermatology. And I did a little bit of digging over the weekend about the dermatology specifically. And you can actually go online, you take a picture of maybe a suspicious mole or a rash. And when you're on that virtual visit with the doctor, he'll want to see those pictures, and they can diagnose and treat over the phone or refer you to a dermatologist. And when brokers are doing open enrollment meetings, and if you do open enrollment meetings with your Cornerstone staff or your UHC staff, one thing that we always like to mention is anytime you can use HealthiestYou, we encourage employees to do that, because these services are not billed as a medical claim. So there's no cost to the member. It's actually free. And this will increase the employer's possibility of getting that refund potential that Ed talked about. So in the state of Ohio, that 50-50 split. So when people use HealthiestYou, it does not go towards their claim experience. Next slide, Ed. Another value add for All Savers and for our MEWA HSAs and our ACA HSA product portfolio is motion. And those of you that know me know that this is probably one of my favorite value adds. And like Ed mentioned, with All Savers, all the plans have motion tied to them. But actually, motion is a walking program, and it incents employees and the covered spouse to track their steps on a daily basis, and you can earn specific dollars, up to $3 a day, to buy down your deductible. So if an employee enrolls in the motion program and they meet all of the daily requirements, they can earn up to $1,095 annually. And if they have a covered spouse, and that spouse is also engaged in the program, the spouse can earn $1,095. So that's $2,190 that can be used towards buying down a deductible. And when we first kind of introduced this program, people said, oh my gosh, look at these fit goals. How are we going to do this? And what I explain is, make it a priority and encourage people to get up become active, count their steps, and make it a game for your employees. If you're doing an open enrollment meeting, have people challenge each other to walk during work, or to have little teams where people can actually, earn money for reaching that 3,000 steps in 30 minutes, 10,000 steps daily, and your fit, which is you have to have a certain amount of steps within 7 minutes. And if you meet all of those goals, you can earn up to $1 for each of those goals, and equating up to $3 a day. Now, effective 1/1/2021, the fit goals are changing. So we are lowering those fit goals from 500 steps in 7 minutes down to 300 steps in 5 minutes. So we're making it easier for people to attain that, maximum $3 per day. Trust me, it's not hard to do if you make it a priority and get people engaged and moving. So like Ed mentioned, All Savers, it's available on all plans. The MEWA and ACA is available on the HSAs only. So once people get their ID cards, we encourage them to go online, register for Motion, get your tracking device, whether it's the Apple Watch or whichever device the employee is going to use, get set up and start moving to lose it. That's my little tagline, move it to lose it. Next slide. The other value add that's been in the market for several years now is called Real Appeal. And Real Appeal is a 52-week weight loss program. People sign up for Real Appeal. They get involved with a personal coach. It's engaging. They receive what we call a success kit, which includes recipe books, a blender, a scale, and they meet with their coach, and they are engaged on weight loss programs. So we have a lot of people that are engaged in Real Appeal and losing a lot of weight, and we've got some success stories where people have actually lost weight and got off of monthly medication. So Real Appeal is included at no additional charge as well. The other thing I wanted to touch base on was ancillary. Very quickly, UnitedHealthcare offers with our medical plans, we sell dental, vision, life, LTD, and STD. We also have a program called Package Savings, where if you bundle the ancillary, the group can get additional savings by bundling. We also have a program going on right now called the Group Admin Credits. So this is for all of our Prime and our All Savers business, group size 2 to 50. If they bundle at least 3 lines of coverage with UnitedHealthcare, they will receive a credit on their invoice if they have a certain premium threshold. You can ask your Cornerstone rep or UnitedHealthcare rep about this program. So that's additional ways to get people engaged with our ancillary products. And the only other thing I would want to say is, in closing, we are ready for Q3, Q4. We are excited about, all the quote activity and, looking forward to a successful 1/1 with our Cornerstone broker partners. Thank you.
Hey, Kim, this is Ed. That's all we had. So we just wanted to say thank you to your broker partners that joined. We want to thank you for putting this together and allowing us to share this information.
We did get a question. We did get a question. I'm sorry, I had myself on mute and I couldn't. I asked it and that's why it was silent. The question was from the audience: what plans include Real Appeal?
Yeah, so Real Appeal is included in every product that we offer in small groups. So it's included at no fee for All Savers, no fee for MEWA, and no fee for ACA. So it's definitely available for all groups we sell side as an Ohio small group.
Awesome. Awesome. Thank you so much. You guys did a great job.
Oh, thank you.
All right. Take care, everyone. We did get another question about can they get copies of the slides? So maybe you and I can touch base after this.
Yeah, we do have to review that and make sure that we can send it out externally, but we just have to have our legal department take a look at it.
Got it. Okay, sounds good. Thank you so much, everyone. Have a great day.
Thank you.
Thanks, everybody.
This ends our session.
Bye.
Bye-bye.